Not too long ago, I spent the entire morning in the operating room on a 4-year-old, and during that case, I extracted 11 teeth. That's the worst part of my job, and it's a terrible way for a young child to be introduced to the dentist. Early dental exams give us an opportunity through caries risk assessment to identify at-risk children before surgical intervention becomes necessary. Early dental visits also give us a chance to practice primary prevention to optimize the mother's oral flora during colonization of her baby's mouth. The Points of Light project is a collaborative effort between medicine and dentistry that was started in 2004. We connect children with dentists. We create networks of dentists at a local level that address 3 distinct populations: infants, Head Start kids, and children with special health care needs. Once these networks are set up, we collaborate with the pediatric physicians in the community, and they guide the parents and the family to our Points of Light website. And by doing a zip code search, they can find the participating dentists close to their homes. And in that way, we make sure that all kids have dental homes, ongoing comprehensive care. Head Start and Early Head Start are federally funded, comprehensive programs covering children from birth to kindergarten. The programs also cover pregnant women. Families living at or below the poverty line are eligible, so when we have children from low-income homes in our practice, we talk to the parents to make sure that they know about Head Start services. Head Start services include growth and development, language and social skills, school readiness, health, and oral health. Parents need to bring their Head Start child in for a dental exam within 45 days of enrolling. Parents must also maintain ongoing comprehensive dental care for their child by finding them the kind of dental home that Points of Light helps to facilitate. Oral health ties into a child's school readiness because if children are having problems, they're not concentrating, they're not sleeping well, they're not eating well, they're not thriving. A child has to be completely healthy to be ready for school. A child has to be ready to go out and launch themselves into the day. And if they have distractions, either health or oral health, they're not going to be prepared to do that. There's a preponderance of data that supports the necessity to provide every facet of a child's readiness. And all of these kids deserve that, including visiting the dentist. Head Start and Points of Light are not alone in understanding the importance of the age 1 dental visit. The American Dental Association, the American Academy of Pediatrics, and the American Academy of Pediatric Dentistry all recommend that parents bring their kids in for a dental exam by their first birthday. Head Start and Points of Light complement each other because we also recognize how important early dental visits are. They're the best way to prevent cavities and to ensure the child's first dental experience is a positive beginning to a lifetime of good oral health. When I talk to other dentists about seeing patients in programs like Head Start, sometimes the question of compensation comes up. I think dentists really want to see these kids, but oftentimes their comfort level in being overwhelmed by these children is not good. They understand, just as everyone else should know, that dentistry knows that children are our most valuable and vulnerable commodity, and that it's not about dollars and cents at the end of the day. It's about doing what's best for kids because it's a reflection of our own humanity as a profession. I'm sure that my colleagues are more than willing to step up and do everything they can for these children once they know that these programs are available for them. We at the Points of Light Project support Head Start's mission of making sure that all children have the best chance at a brighter future. And that's why Points of Light is so interested in working with Head Start to help infants and young children get coordinated, ongoing, accessible, and comprehensive dental care. Dentists who want more information can visit the Points of Light website. They can register to accept infants, Head Start patients, and children with special health care needs while on the Points of Light website. Parents can use the dentist locator on the site to help find a Points of Light dentist in their area. The site also has educational videos and other information that dentists and parents will find useful. If I could say one thing to my colleagues that would make a difference to kids' lives, they need to have skin in the game. They need to see themselves as the answer to the problem. And by doing so, the richness that they would get from their professional lives by really just jumping in with no fee and complete commitment and saying, this is my community. I'm going to make it better. I'm going to do everything that I can to make sure that the kids in my community have better oral health. That's what they all took their oaths for. I mean, you graduate, you take the title, you take the responsibility, and the reward of that professionally is, I just can't begin to describe that. And I know so many of my colleagues that already do that. They already approach it that way. And they're some of the most committed and happiest professionals that you would ever meet. That's what I would say. Get in the game. Make it happen for your community.